Hello, I'm Valeria Esquivel. I'm the author of Chapter 3 in the UNRISD Flagship report. Chapter 3 is about transformative care policies. The chapter has many messages, but they could boil down in 3. The first one is that framing public care services, basic infrastructure, labor and social protection policies under the umbrella of care policies, as target 5.4 of the SDGs does, can become a game changer. It can help push care policies up in government agendas and creates the opportunity for women's movements to support, shape and hold governments accountable for their implementation. The second idea is that transformative care policies are those that simultaneously guarantee the human rights, agency and well-being of both caregivers and care receivers. Care policies, therefore, need to be assessed with regards to their differentiated impact on care receivers and on caregivers, avoiding the potential trade-off that divergent interests might have. This perspective rebalances previous approaches that tended to focus either on care receivers' well-being or on gender dimensions of caregiving, as most of carers, both paid and unpaid, are women. I must say, however, that transformative care policies cannot be achieved without also tackling the social and economic drivers of multiple inequalities, including those based on gender. The third idea is that elements that have been decisive in making care policies transformative are progressive political framings, broad political alliances, and innovative use of evidence. Contextual factors have also helped: dynamic labor markets, increasing female labor demand, availability of funding for care policies. Transformative care policies are more likely to emerge when channels for social dialogue are established with women's and social movements, trade unions, and also with organizations of persons with specific care needs, like persons with disabilities, in order to set priorities and inform policy design. When institutional coordination exists and effectively bridges sectoral divides across health, education, infrastructure, and social protection sectors. When a strong gender perspective is built into the design and implementation of care policies, and decent working conditions are offered to paid care workers. Finally, when care policies are framed within a universal, human rights-based approach to social protection, like in the example of the national care system in Uruguay. Those were my 3 main points. I hope those ideas make you read the chapter, the link below. Thank you for listening. Bye.